Welcome back, users, to my channel of Everyday Life with Aspie. If you're following me right now, I'm AspieAnswersAll, or I'm known as Aspie for many of years. I'm all about creating mental health and awareness, which is sharing my life stories and experiences with this Bridges syndrome and everything that comes in the territory with it of my personal struggles and life experiences along the way, hopefully with some tips and advice versus just also just giving you some pointers of my knowledge and understanding and experience on the mental health disorders and just health and awareness in general, as well as also giving you guys some support regardless of what you go through in your personal everyday struggles, and hopefully that you'll learn something, learn every day based on who and what we are as a person, and we grow and to know each other. If you're following me right now, I'm doing this series of basically PMDD or premenstrual dysphoric disorder, which basically is broken down into three parts. I've already done the first part, which is the introduction of what it is and basically the classic signs and symptoms that you have to look out for. Just to bear in mind before I continue on though, as a disclaimer, as always, I'm not a medical professional. I'm just a normal everyday person going on with her personal struggles as best as she can and just sharing my life stories and experiences. But I'll give you some tips and advice along the way on how to manage or treat some of these symptoms that may be aware. But if some of these warning signs and symptoms is coming to effect of you guys, seek professional help or in a way of medical advice or just help in general, or even for your family or friend that you feel that's close to you that needs that help, because as I said so many times before, I don't condone basically self harm or any other forms of injury that will self-inflict. Right, and all we're going to do, guys, this is part two, hopefully, based on my topic of PMDD, the premenstrual dysphoric disorder. Bear in mind also, just on a brief note before I continue on, I apologize in advance for some of the pronunciations of my words. I'm doing the best I can for these clinical terms, basically. Even though it's been a long while since I've been in the medical field, based on my life experiences and training of certain bits and pieces through youth line and every other place that I may have come across with some of these conditions. So we're all learning something new every day, hopefully. So let's begin this anyway before I run out of time. So this is diagnosing PMDD and the treatment side of it. Okay, as you're aware, or if you have any of the above symptoms as I addressed in video number 1 of the very introductory of what it is and the symptoms of this, basically it pays to go to your doctor and seek medical advice regardless, so they can review your symptoms regardless what it may be, and then obviously within that they can do a full-on medical history about you and will give you a thorough medical examination through and through. Then again, that will lead into maybe if it was their turn of concern, basically it's a form of doing a thorough medical exam, as I said, with the psychiatric versus the evaluation may also need to be included in this examination. But before they do make a diagnosis, however, they will rule out any emotional problems, basically such as depression or panic attacks or panic disorders as such, as well as any other underlying medical or gynecological conditions such as your fibroids or endometriosis, menopause, and/or hormonal problems. PMDD is then diagnosed, whereas at least 5 of the above symptoms that I've included in this, everyday topic that I just brought out of the introductory, basically, and this, including at least one of the first 4, will occur for most of the time during the 7 days of the, before the menstruation cycle begins, or what have you, or even ends. It may go away within a few days, then start off again, at the start of the menstrual cycle or period. Okay, treating PMDD is just like any other form of mental disorders or just disorders in general, regardless what it may be. However, it's just similar treatment strategies that is used to treat PMS, which I'm going to address what PMS is and all that, and other, like I said, body disorders later on. But for now, I'll just focus on this one. So tip one for this is number 1 is good nutrition. Sometimes it would be good for us females to limit the intake of caffeine, sugar, salt, and alcohol. Number 2 is exercise. Obviously, exercise is key for any management tool for us all in everyday life of anything in general, just to keep us fit and active for good 30 minutes a day. They suggest that sometimes aerobic exercises such as your walking or swimming may be beneficial, as well as some other forms that can be of benefit for us. Number 3, medications. Some antidepressants and anti-anxiety drugs basically can be of use to us, but you've got to bear in mind that some of the anti-anxiety drugs and antidepressants can be, really addictive if it's not given in the right dosage. So bear in mind to, as again, seek professional advice on this forefront, as well as just basically seeking out what works best for you in that dosage and whatnot. Also, another one that you could do is some hormonal kind of drugs, basically. Like surgery obviously will be the last resort of, the treating part of it, physically. Birth control pills maybe can be best helped, as well as, the hormone pills I was talking about there. What I meant was the progesterone and the estrogen that are important for us females to produce. And also another form of treatment is counselling, as some sort of behavioural therapy to put into place, and whatever else it may be. Well, this is a real quick, short, brief overview of part 2 of the treatment and therapy, or shall we say diagnosing of PMD. Give me the like for thumbs up for support. Comment below if I missed anything, or feel free to comment if you do suffer from this and you want to, come on board for open discussion, so that every one of us can understand how you guys deal with this everyday struggle of this disorder. Feel free to follow me on Twitter, Facebook, AspieAnswersAll. Feel free to subscribe to my channel if you haven't done so, so you know what's kind of be coming up next. Feel free to also, share these videos around for whatever reason it may be. So without further ado, guys, thanks for the support, thanks for watching, do what you love what to do. AspieAnswersAll signing out. Ciao for now.